Hey there and welcome. Today we're jumping into a really important topic, women's health. We're going to break down some of the unique challenges that women face and look at how personalized care can really make a difference, no matter what stage of life you're in. So let's dive right in. It's so true that every woman's health journey is completely different. And that's exactly why the care you get should be too. It has to be personal, it has to be compassionate, and it absolutely has to be tailored to what you need. Think about it. From your teenage years all the way through menopause and everything that comes after, a woman's body goes through some pretty amazing transformations. And really, just understanding what's happening is the very first step to feeling in control of your own health. Okay, so what are we actually talking about when we say unique challenges? Well, a lot of it comes down to hormones, reproductive health, and just the different stages of life. Let's break down some of the most common things that come up. First up, let's talk about menstrual health. And I'm not just talking about a little bit of discomfort here and there. I mean things like really painful periods or cycles that are all over the place. Stuff that can seriously get in the way of your day-to-day life, affecting your work, your social life, everything. Then there's something called polycystic ovary syndrome, or PCOS for short. And you might be surprised to hear this, but it's actually super common. It affects as many as 1 in 10 women. The tricky part is that the symptoms are all kind of connected. So if you're dealing with irregular periods, sudden weight gain, and acne, those could all be signs pointing to the same thing, something that's worth looking into. And of course, menopause. It's so much more than just the hot flashes everyone jokes about, right? It's a huge biological shift, and managing the symptoms, plus keeping a close eye on things like bone health, is absolutely crucial for staying healthy and feeling your best as you move into this new chapter. Okay, so knowing about these conditions is step one. But step two is just as important, knowing when it's time to actually do something about it. Let's talk about the signs that mean it's probably a good idea to seek some professional advice. This right here is a really important checklist. Seriously, if any of these things are ringing a bell for you, like periods that are always irregular, or maybe you're worried about fertility, or you just feel off, that's your cue to take action. And things like unexplained exhaustion or mood swings, that's not something you just have to power through. It could be tied to your hormones. The bottom line is, you don't have to just suffer in silence. So here's a question a lot of women have. We're often taught to just deal with period pain or irregular cycles, right? To just write it off as normal. But if it's happening all the time, how soon should you actually get it checked out? And the answer couldn't be clearer. You should be evaluated promptly. Don't wait. Don't put it off for 6 months or a year thinking it'll get better on its own. Getting looked at early can make all the difference in figuring out what's really going on and getting it under control. So you recognize the signs and you know you need to act. What's next? Well, finding the right partner in your health journey is absolutely key. And this is where a family doctor can be such a huge help because they can look at the whole picture. So what does that holistic approach actually look like? Well, it's pretty straightforward. It all starts with a thorough evaluation. We're talking checkups and probably some hormonal blood tests to see what's going on with your thyroid, reproductive hormones, that kind of thing. From there, it's about managing your symptoms and then, really importantly, focusing on prevention to keep you healthy in the long run. And you can see here how it all connects. If the concern is something like PCOS, the support is going to come from a few different angles, maybe medications, some lifestyle advice, or even a referral to a specialist. If you're navigating menopause, the focus is on managing symptoms and keeping an eye on bone health. And for fertility, it's all about getting personalized guidance, whether that's about contraception or planning for a family. It's a really clear map from the concern to the care you need. Here's another big question that comes up a lot. Can you treat menopause symptoms without using hormones? Because for a lot of women, hormone therapy just isn't the right fit, or maybe it's not even an option. So what else is there? And the answer is absolutely yes. And that's really empowering, isn't it? It means there's not just one path to feeling better. A good doctor will work with you to find what works for you, whether that's making some specific lifestyle changes or trying out some really effective non-hormonal treatments. And really, all of this brings us back to one central idea: empowerment. Being proactive about your health isn't just about putting out fires when they start. It's about taking the wheel and being in charge of your well-being for the long haul. And why does this kind of approach work so well? Because it's all built on trust and consistency. You get supportive, private care that grows and changes right along with you, from your teens all the way through menopause. It creates this one complete picture of your health. At the end of the day, it's about so much more than just the physical side of things. Having someone you trust, an expert who really gets your personal journey, that gives you an incredible amount of confidence and just peace of mind. So I want to leave you with one last question to think about. It doesn't have to be some huge, life-altering change. It could be something small. Maybe it's finally scheduling that checkup you've been meaning to make. Or maybe it's just tracking your symptoms for a month to see if there's a pattern. What is one small, proactive step you can take this week for your health?